that's what I was doing this morning. So I was setting up this camera here. I was like, shoot, we got to have some quality here. Got to,
Yeah.
brand,
Yeah.
But
Yeah.
so
Well, hey,
I was
everyone.
sweating it.
Yeah. Welcome to the Biohacker podcast. Back here, Biohacker. This is Steven. I'm here with Dr. Ben today. And we met yesterday in OsteoStrong, or 2 days ago, I think. It was on Wednesday. He came in with his wife or girlfriend?
Girlfriend, partner. Yeah.
Charlene, I think. Yeah, lovely.
Yeah.
And they experienced OsteoStrong and we met and just kind of hit it off. We had similar backgrounds and we just kind of resonated. And I really resonated with your story. And I just appreciate you coming on today and sharing a little bit more about kind of what it is you do and the impact you're making in terms of other people's health and wellness. So thanks so much.
It was cool how we connected too. It was another health provider, and it was really just a testament to being plugged in with your community and just, maybe we don't do the same things, but how we can really kind of facilitate, getting people just collectively healthier in our community, and each of us kind of offer something unique that can be utilized by our community. So it was super awesome. We loved the OsteoStrong. It was great. You guys were just top notch, and it was a great experience. And again, a connection that probably would not have been made had we not known other medical healthcare providers in our vicinity. So It was a really cool connection.
Yeah, very cool. So Dr. Ben, tell us a little bit. We were just chatting before we jumped on here, like just a little bit about chiropractic. What is it? Is it safe, and kind of what problem does that solve?
Yeah, chiropractic. If you ask every chiropractor, they might subjectively give you a different definition. Everybody kind of has their own what chiropractic means to them, but traditionally, when people think of chiropractic, they think of, we take care of the spine, the spinal column and the nervous system, because your spine is the supporting and protective mechanism for your entire, spinal cord, which is a big player in your nervous system. Why you and I are able to, hop on the computer and talk and see one another, like our nervous system is functioning properly. So we're able to interact with that in just everyday life. Our human experience is based on our nervous system operating properly. So that's really what chiropractic is. And again, traditionally folks think, oh, it's the old Hollywood, oh, I don't want you to adjust my neck. You're going to, too many Chuck Norris movies back in the day. But no, it's about supporting and nurturing the spine and nervous system. And we've seen with data and studies that come out that when we use a safe and effective and drug-free intervention like chiropractic, it really has this ripple effect to many systems of the body without, like, as I said, not drugs or an invasive procedure. So we're really starting to get a lot of traction with that. And that's why it's so easy for me to get fired up over chiropractic, because it does so much and it can help so many people. So that's what chiropractic is to me.
I can really see it. You can really see the passion come out and the energy behind when you talk about it. Can you tell us about your background for people that don't know who you are? What drew you to that? What led you to that growing up, and what's kind of your story leading into getting into that?
Yeah, chiropractic is generally, when folks, find chiropractic, they have their own kind of origin story of what brought them to it. And I'm no different. Mine would just started really early. I'm originally from northern rural Florida, ever in the Panhandle, just outside of Tallahassee. It was just like a 3-stoplight town at the time. And my father, big outdoorsman, hunter, like worked in the oil field, just like big, strapping, strong guy. So of course, as a young boy, like your dad is, like whatever he does is just like awesome, and he can do no wrong. So seeing that and growing up in the woods and doing all the outdoorsy stuff, and then he actually had a disc issue in his neck, which just absolutely sidelined him. And I, seeing that at such a formative age, and seeing what he was, then he was just like on the couch and in pain and like not doing as much, didn't want to do things. So I'm like, man, I don't know what happened, but this is a different version than I'm used to seeing. And then I guess, it's a small town. So the chiropractor luckily lived a few houses down, and my dad started going in and getting treatment. And I mean, it was a long time ago, but I do remember him like getting back into that former version of just like, he's back out and doing the things that he wants to do with the quality of life. So I was like, I don't know what happened, but he's back. And, as I kind of mentally kind of gathered, it was chiropractic and the chiropractor down the street, one of our neighbors. And it was, that really was just like the domino that's really started everything into place of where I am today. So, it's funny now being a chiropractor myself, kind of retrospectively looking back at that chain of events. Yeah, it's an interesting story, and it was just personal to me. And when you kind of like find your mission, what can I do to really make an impact here? It's like, man, I know I saw what chiropractic did, and now being in chiropractor for several years now, it's like that affirmation that like this was the right choice. We are doing something good in the community. So it's kind of my origin story, and I'm glad you asked that question. I love telling that story.
Yeah, it's amazing the wellness that you're bringing. I mean, the ripple effect that has. That's really what hit me on that, was that ripple, that one chiropractor helping your dad feel better. Now look at how many lives you're changing now because you saw that, and it's like, wow, that's where we know one person can affect 100.
Yeah, so. And you said the ripple effect, and it's just making different decisions, like how making proactive and healthier decisions. And we see it all the time, is like if one person in the family starts trying to become a little bit healthier and taking care of themselves, that really like their partner gets on board. Like if they have children, it works up and down the chain. It's so it just takes that, like talking about earlier, that domino. It just takes that one little bit of just like momentum to get the ball going, and then just the snowball takes off, and then their family gets better and they show up better for their community or in their job or whatever it is. And it's just that kind of endless, not want to be too woo, but it is that endless like ripple effect of just making, positive, healthy decisions, and how we naturally feed off one another, both good and bad. So when there's good momentum going, it really can make a big impact.
Mm-hmm. Yeah. I often like to talk with people and tell them, like, momentum, like one decision, if you can break that first step into like 3 baby steps, you're going to now have 3 decisions and go follow through 3 different times to get to the same place you would if you just did 1. But in the process of breaking it down into 3, you now build momentum, right? Because you've had a consistent pattern of 3, and now you're in that momentum. So you got to the same point, but you now have momentum, and going from 1 to 2 now is a lot faster than if you didn't have momentum. So
yeah, it's those small actions, like the old proverb of like, how do you eat the elephant? Like one small bite at a time. If you look at this big behemoth of a hurdle that I've got to get over for like my end goal on the other side, or my desired outcome on the other side, then we'll stay on this side of the wall, just in awe of the obstacle that we have to do. So yeah. I think that's a big part too of trying to pivot people into a healthier and making decisions that will benefit them. There is that big hurdle, because generally it's someone who's trying to make that big shift. And we all know that like behavior change is such a hard thing. So that's when like having someone there, like you guys walking through OsteoStrong, like you're there with, your clients that are, probably wrestling with a little bit of, maybe not mentally, but maybe physically they don't like where they're at, or their DEXA scan came back and now they're that the chink in the armor. Now I feel, oh God, I'm mortal. But it's like, it's about where we're at right now, and what can we do, and what are tangible steps we can do to take forward to get the outcomes that we want. So I think there's a lot of carryover there with what we do, and like just having that relationship with patients and you guys with your clients, taking them through, and then seeing you guys do that. It's like, we need that accountability person, that someone to like, when we're subjectively not feeling it, someone who's like really there cheering us on, or objectively, hey, where we're at, let's stay on the path. This is good. Those kind of things that really can keep you on it, as opposed to falling off and like, it's too much.
Right. That's why I like a coach or a mentor, or even just a friend who's there as a bystander, right? Just an observer watching you play the game, and someone to check in with, and someone who's accountable. That's so
Yeah,
important.
that social pressure a little bit. Accountability, that
Mhm.
social pressure, like, oh,
Yep.
okay, like, I mean, it's a real
Exactly.
thing, so hey, play
Yeah.
on it,
Yeah.
so it's not always a bad thing. So you can play
Right.
on it a little bit, because we all need that external push at times. If it was all internal, then the world would look like a different place. But we all need that accountability and that push.
Definitely. Yeah. And we know from playing baseball, you don't want to have a false step, right? You don't want to have energy and stay where you are, lose ground. We always are moving forward, right? It's like always moving forward, but we can break down the size of the bite that we're taking. Because, right, if we're overwhelmed, it's just we're trying to eat too much of it at once.
Yeah.
It's just like, hey, take smaller steps, but continually move forward. I think a lot of us get caught up and we just churn and kind of tread water and kind of in a survival mode. And we're just kind of treading water. We're not actually making forward progress. And so I think even just the smallest step forward that actually moves the needle is more impactful than like endless activity that's just churning the wheel. What do you
Yeah,
think?
I think we sometimes we can mistake busyness for progress, like you were saying,
Yeah.
churning and treading water. But it's like when we do take those small, tangible, and you talked about momentum, like that's a real thing. And especially when someone like starts to build that momentum, they might not know it at the time because again, they're probably making a big change, and this is all kind of uncharted territory. But you see, like, okay, this was a big breakthrough for Susan, and you really got to celebrate those wins because that again, that positive affirmation, that positive momentum, as well as the momentum with them making healthier decisions. It's like you have to celebrate that because they don't know. I don't
Mhm.
know if that's good for me or not. I'm just kind of doing what I think should be done. But having that again, affirmation, like, yes, this is good. This was a big win. And that you get that dopamine response, then you're really wanting to that,
Yeah.
you're achieving something, which we all have something that we need to be purposely pursuing. That's just the thing. That's the human experience.
Hmm.
Um, and get to the top of the mountain. What is there? More mountains. So
Hmm.
but yeah, breaking that down early on and really celebrating those wins is a big thing. Which I'm sure I was looking at you guys' chart and the progress and of different places, and I'm sure you can talk about like the journey of that people go through. They're super fired up when they start. They might hit a little bit of a lull, and that's the body adapting. And they're you talk about that a little bit.
Hmm. That's really it's something, the ones that get to the top of the mountain, like you're saying, those are the ones that have a reason bigger than themselves. Those are the ones who have, a lot of times when they come in, if you have a DEXA scan or someone who's been diagnosed with osteoporosis, their dreams are taken away. Like there was one lady that came in that she wanted to continue being active with her husband, but she didn't feel confident enough to even get on a bike. So she would have to stay on the porch while he rode his bike around the block. Like imagine that. Just imagine him riding away because she's in too much fear that she might fall and hurt herself. So like that's not it's a physical limitation, but it's also a mental and emotional limitation too. So to have a reason to, make a change, to have a reason big enough, because just for yourself, that might not be enough. Sometimes we'll do more for other people than we will ourselves sometimes, which is again why that coach helps. But it's that external accountability. But like for me, like I want to be strong enough to be able to carry my daughter even as she's growing up, getting heavier every day.
Mm.
But that's something bigger than myself. And I want, to make an impact. I want her to make impact. I'm thinking about the people she might impact if she's raised with a healthy, strong dad. Like she's going to have all these benefits. And I'm thinking of her benefits more than like my own benefits, because it benefits me indirectly. But I think that's the people that make those, are we have weekly sessions and there's people doing 160 sessions. They've been doing this a long time. And the ones that continue have reasons bigger than themselves. It's either their family, they want to see their daughter get married, right? It's their, their strength. They want to experience something. They still haven't checked every box on the bucket list, right? Like they still have reasons that are bigger. They might be theirs, but they're also including other people. They're also like because, of someone else. And I think that's a key, is when we make goals, like how many other people are going to benefit from my goals? Which I think a lot of times we make goals because it's what we want, but there's a lot more energy in giving, in seeing the benefit of the whole entire world outside yourself that benefits from you getting your goals.
Yeah, and tuning into that collective, and like something outside of you. It's an interesting phenomenon. Maybe it's not a phenomenon, but it's just an interesting observation that, as you're saying, when people have like a certain why, like they will move mountains, and their why. I say majority of the time that why is not anything to do internally. It is something externally they're having to show up for. And you're talking about, that was a great analogy or situation with a partner wanting to show up for their partner. It's like, so it's not them, they're wanting to show up and have those experiences. And, or you were talking about pick up your daughter and all those positive, just the positive influence if she sees an active father, and someone who's like in the same thing I was talking about my story, like a physically active. So it's like that is like conditioning, and what they mimic what they see. So that's a big thing too as a father. I'm not a father, but I that is something you're talking about, checking the boxes. That's a life experience that I greatly look forward to. And that's like front and center of like showing up, being the good example, because that lays the foundation for, again, how they're going to impact people after you're gone, So it's one of those, again, something outside of you, having a strong enough why. We'll figure out the how. If your why is good, we're going to get to the goal.
Yeah. Right. And even at OsteoStrong, we'll bring clients in and have their why statement written out, so that every week we're checking in with that. Because that's how you check the box, like check in and revise it. If it changes, like revise it, but have it in front of your mind, like you're saying, right in front of your mind every day, right? Have the definite chief aim. So,
and because you're talking about that momentum, it's like you just get bogged down on that, and like you get just in the trenches, and then you need someone to kind of give you that 30,000 foot view of like, hey, here's why we're doing it. And they also associate that, like, man, at osteo, or you are that like kind of psychological coaxing to like bring the why front and center. Because if you lose that, that's usually when things get off your off your purpose, whenever you lose that. So having those things built in, and I think that's a great thing, for your clients to identify their why, because then it just helps them follow through and that's going to get them to the result that they want, which is a better quality of life. So.
Yeah. And really it's a little uncovering and it's a little digging, because most people say, oh, my shoulder hurts, or, oh, my back hurts, but they don't look deeper. Like, what is that holding you back from? What's the cost incurred because you can't experience physical freedom? Like, what are you not able to do? And that's sometimes, getting back kind of to chiropractic, what conditions can be treated, and how often? Like, how would you know that you need chiropractic or something like a intermodality,
Right. And a lot of it has to do with the principle you just talked about, is like peeling that back and really unveiling what they want out of that. Because anybody can walk in the door and say, obviously, oh, my neck hurts, or my shoulder, my low back hurts. Like that's just the surface level. Is okay, that's doing it. Generally, they come whenever that is now interfering with that quality of life, or that activity that really kind of fills their cup up. Like if it's a biker or a snowboarder, and I can't or ski, or my mountain time has been diminished, or I can't spend that time with my partner, like this is greatly affecting. So that really brings them in. But back to chiropractic, it's traditionally, neck and low back pain are the two things that have really gotten a lot of traction, because now chiropractic is starting to be more in the, I guess, clinical protocol. We're not just jumping to injections and surgery and a lot of these invasive procedures. And it's been found that a lot of we're getting great outcomes with the traditional neck and low back pain. So those are the two main things I would say, and just spinal column pain, or restriction, dysfunction, however you want to call it. But generally, pain is a great motivator. It's the universal language that we all understand. So that's usually what brings them in the door, the neck and the low back pain. But once we unveil it, we find that, oh, maybe there's a knee that's now, if my hip isn't working right, my low back hurts, and my knee. And our body is not just like chunked into these segments. It is this, you know, it's the systematic thing that works together. And if something's off, it's a master compensator. So we can, you know, get away with it for a while, but you know, eventually you have to get in there and correct those issues, or else then it gets to that point where it's really interfering with your life. So neck and low back pain, but a great example that I use with kind of the chiropractic utility is like I would challenge you to look at any professional sports team, and every single one of them has a team chiropractor, and their bodies are their vessel to, you know, make their living and have their experience. Like you and I were talking about Tom Brady in office and recovery and those kind of things, like, because that's, you know, he's peak and, you know, that's his Super Bowl. His body has to be there. But that partner that doesn't want to go get on the bike, you just mentioned, like her Super Bowl is getting on the bike. And it's like, so it's like, oh, well, that's just what they do for the creme de la creme. It's like, no, this is your life and showing up to the things that really matter to you. That's what chiropractic can help get you to. Mm-hmm. So you come in, you have an exam, we establish your why, which is a big part of it. And then find, okay, well then what are why are you doing this? Then what are the goals? I mean, if we just want to get rid of pain, okay, cool. Like we can do that. Chiropractic has shown to be very effective on that. But if we want to maybe make more, kind of getting back to like the conscious decisions of making healthier choices that have that ripple effect, now we're starting to get some traction there. So okay. That's what chiropractic can do.
Yeah. So you mentioned kind of the pain and injury reduction, like the reducing pain and injury. Mm-hmm. When people come, like, how do you keep people coming back after they're out of pain? It's kind of speaking a little more to the why, I guess, that keeps them going. Because we'll have a lot of people come in and, you know, we'll help their knees feel better from arthritis, but then they forget that they were ever in pain in the first place. So they quit because they're like, oh, I don't need this anymore. And we're like, no, we don't want you to go back to that. So like, how do you kind of keep people going, say more than, you know, a few weeks or a month, you know?
Yeah. And it's all about framing the experience. Like you have the pain, that's what brought you in, but only 10% of our nervous system is pain signaling or like pain sensing. So the nerves go all through our body to every organ, tissue, and cell of our body, but there's only 10% of it is pain. So by the time, if you look at it kind of like as a threshold, we've had dysfunction and things that are going wrong, but again, our bodies are master compensators. So we don't even notice it. It doesn't even register with our brain. But once we get to that level of dysfunction, well, now we've tripped that pain cascade. Oh, okay, now I need to do something. But that dysfunction was happening long before the pain showed up. So it's about educating them is like, well, if we're always relying on pain, it's like with your car. Do I have to wait till I'm broken down on the side of the road to know that I probably need to do something? It's like, no, I come and I get my everyday drive every 3 months for some of us. Some of us aren't on top of it every 3 months though.
Yeah. But what's your maintenance plan? Yeah.
Exactly. Yeah. And it's the same thing. I call it wellness care. It's like you have, 26 segments of your spine as an adult that are individually working, but also in in concert with each other. And if a couple aren't working properly, you have a lot of other people to share the load. But if we have a 5-man job and 2 guys just say, man, I'm not feeling it today, those 3 guys can we do the work? Yeah, but eventually we're not going to want to do this anymore because we need all hands on deck here. And it's the same thing with your body. So that's how we do it. Just educate that, if we're always relying on pain to be the indicator of when we need to take action, that would be like you, again, breaking down on the road, multiple times in over a few year period. And finally it's like, hey, Stephen, how about you just take it in and get it serviced instead of you have to call me and come pick you up every time. And it's an emergency. Like,
yeah. Right. Yeah. I love that. I love that analogy. Right. It's like, you're not going to wait until you're broken down before you get some, care. So,
yeah. But we always, it's interesting. And you're talking about things that are outside of us, we value more than sometimes our why. It's like, well, I get my teeth cleaned every 6 months, or I floss my teeth every night, or I get my tires changed religiously or rotated, or all these upkeep and maintenance things to keep things going in their life. But it's like, when you apply that same principle to themselves, like, nah, I don't need it. So
Yeah, right.
Their most important asset. They're very, kind of putting it on the back burner until that pain or that report or whatever it is kind of comes front and center, and you say, okay, we need to get a plan together to address this, because I got a lot of experiences I want to do, and I don't want this to be hindering.
Mhm. Yep. Yeah, I don't know if you can see your camera turned off.
Oh, shoot. Unreal.
It says, yeah, imaging web.
Can you hear me though still?
Yeah, no, I can hear you. That's why I didn't say anything right away. But yeah, that was good. Good stuff.
Huh, that's weird. It should be, well, tell you what I can do here. Video. Let's go here. We'll switch it to the normal camera.
I was curious what's your average client lifetime? Like the average of like how many times people come see you or how many times they come back? Just over the course of a client journey.
Yeah, and that really that depends on like what their presentation is. If you come in with just a minor tweak, and you're 30 years old, your healing properties are much more accelerated than someone who's 65 with a lot of spinal arthritis and stenosis. That person's going to need a little bit more care. So really, if someone says, hey, it's going to take this many visits, like very concrete, like I don't know how accurate that is. So I always try to frame the experience of, hey, this is what we found. And you always check in. It's not like a hard and fast thing. We, check in, we have re-exams. So like you said, sometimes goals change or the conditions change. So we're not just a decision we made 30 days ago is no longer serving us. Hey, we'll switch the plan up, and we kind of, so it's all about in the exam and then just those checkpoints every day. They come in the office. Hey, we're checking how they're doing. Better, worse, same, what worked, what didn't, so it's checking in every single time. And that helps us kind of recalibrate and stay on pace. Yeah. But if it's just acute low back and neck pain, you can, I'd say within probably, a range of 6 to 12 visits, you really start to see a lot of changes there. And then just like anything, we really have to elicit a lot of change. But then once we get more on the maintenance and wellness care, you've kind of elicited that change within your body. And it's like working out. You got to get in shape. But once you're in shape, it takes very minimal inputs to maintain that level of performance. And your spine's the same way. So that's kind of generally how it goes there. We go from acute, the pain brings them in. We address that, we get that under control, and then we kind of but it's on the front end, you educate them. It's like, okay, now we want to maintain the work that we've done. And it does take inputs. If I stop working out or stop eating well, my body no longer will elicit those, results. Mm-hmm. So that's kind of a normal, course of care.
That's great. Okay. So yeah, you kind of mentioned pain brings them in. How would you answer, like, if I'm not in pain, why would I seek care?
I'm going to go, I would say right back to the analogy of like, that we don't have to wait till something's going wrong for us to take action. Like when you boil it down, it's a proactive versus a reactive approach to your health. And that is ultimately, I think, what you can boil it down to, besides the nuts and bolts of whether it's, chiropractic or acupuncture or osteostrong or any kind of modality or any kind of situation, like the car. I don't have to wait for it to break down for me to know that I need to probably do some things to maintain it and assist it. So you're trying to, it's not a guarantee, but I'm doing everything that I can to assure that it's going to perform for me, whether it's my body, my vehicle, my finances, all those things. Like you try to just do everything you can to give yourself the best chance. And so with the same thing with the pain, with the pain, it's like the 90, back to the 90-10 rule. It's like only 10% of your nerves sense pain. So if we aren't having that dysfunction at those certain levels, then you're not going to know, but that dysfunction is still there. And our body is keeping score the entire time. Our recency bias, you talk about, people come in like, well, my knees don't hurt anymore. I guess I'm good. It's like, you forgot where you were, Jim, when you first came in, it's like,
Yep.
so yeah, so
Reminding.
it's just, yeah, it's about educating though, and just knowing that, you like the results that we've gotten. Well, those results, aren't just unique to you. Our bodies are very dynamic. They need to have certain inputs to elicit change. And on that same, I guess, wavelength, people don't see change fast enough and they get discouraged is a big thing too, with just healthcare and health in general, because our bodies are meant to maintain like a very consistent level, like homeostasis. That's why if I eat one, have one cheat day, I don't blow up and become obese. If I, work out one time, I'm not Mr. Olympia. Like, your body has a way of kind of keeping everything the same, and keeping things pretty, I guess, normal. And then but in order to elicit change, it has all these corrective mechanisms that you have to stimulate over and over again to elicit those changes, especially with health. So that's another component of it too, is educating, like, what is the healing journey, and what is change in the body? What does that actually look like? Everything else in the world is super quick. Our internet super fast, and our TV dinners give us 1 minute. I got something I can eat. It's like, everything else is sped up, but our, physiology is still in a very, like, evolutionarily old, I guess, state. So it still needs some core things in order for it to respond. So it's also wrapping up, trying to illuminate that incongruity with like technology and speed and how fast life moves, but then also how our body moves and what it really needs.
Yeah. Wow. It's a big gap. I love that thought though, of bridging the gap, slowing it down, being able to speed up maybe by slowing it down, because we're more aligning. I feel like that just kind of goes into more, spiritual or maybe quantum physics type of thing, where it's like, hey, if we align, things happen instantly, where there's no longer effort. We're not having to push as much as feeling pulled. And I think that's great. That's good stuff. Kind of changing segments here for seniors, like maybe someone who would be interested in OsteoStrong because they have bone density issue, who might be like osteoporotic or osteopenia. What can they still receive chiropractic care?
Yeah, this is a common question that we get a lot, because they'll get those scans and they're just like a little bit of fear. It's like, man, what can I do? And generally when they get it, it's like, oh, what does that mean? It means your bones are brittle and they can break at any time. So you better just like, wrap a bubble around you and that's your existence. But luckily now I've had a lot of experience, especially working with some of our senior population, and their bodies respond so well to chiropractic care. But we have to go about it a little bit differently. It's not the stuff that you see on TikTok whenever, you're really giving a good manipulation or a good adjustment to a younger spine that can handle those forces. Just like you were saying, that osteoporotic or osteopenic bone, like, it cannot absorb as much force, and it just can't do it anymore, which if you stimulate it in the right way, like what you do at OsteoStrong, it will respond. But that's just, again, a snapshot in time. Like, it is a dynamic thing. We can change it for the better, or if we do nothing, it can continue to wither away. But with chiropractic, it's a much more gentle approach. Do we still adjust and mobilize and move the joints? Because that's really what we're doing. That's how the joints nourish themselves, through movement, and our bodies stay healthy, or we're meant to move. Whenever we move, we're pretty healthy. Whenever we don't, things usually go downhill pretty quick. But especially with some of the technological advances we've had in the field, it's called instrument adjusting. So as opposed to more of a hands-on traditional manual manipulation to the spine or the joint, this actually is a smaller, it just looks like a small, like, drill almost, and it sends small impulses into the joints. And you can calibrate how much force is going in there. So you can calibrate it really to see, and it's an objective way, because if I'm doing it with, with my hands or without any kind of objective measure, it's like we can really know, like, tune in the instrument. We know how much force is going into that joint, where we're putting that force in a little bit more specifically, but also we can check in to see, like, hey, objectively, what were we doing? How did they respond? And where can we go from there? So instrument adjusting is a great way for us to still elicit that movement at the spinal segments, which again helps them stay more mobile, helps them stay more active, which especially in our seniors, that's the biggest thing. Like what we value in our 30s is much different than whenever we're in our 60s, 70s, 80s, 90s. Like we want to stay on our feet. We want to stay mobile. We want to stay independent. Those are big outcomes that we want. So we're still able to give our seniors the chiropractic care and give them that movement that their body desperately needs at this time. So yes, there is a way. It's a long-winded way of saying it, but we can still, our approach is a little bit, our approach is definitely different, but we're still able to elicit those positive things that people associate with chiropractic.
Yeah. Okay. Cool. Who do you love working with? Who's come in? Who can you think of that's come in to your office and you just love working with it? Like what type of qualities do you love that people have that are your ideal client that get the best results?
Yeah, it's the people that I know, I feel like I'm beating a dead horse here, but it's like it's the why. We talked about it earlier. It's like when people that have a why, because then it's not that I can just get lazy and they're just super motivated, but it's like those are the people that are going to actually stay on course with our treatment plan, and the people that are going to have follow through, and also the people that are going to really value the results that you get. Because you mentioned the recency bias, like whenever, I get out of pain, okay, I don't have pain anymore, but they kind of lose like what life was like a little bit, just because the recency bias. We only remember what happened, the most recent thing. But
Yeah.
I honestly, and the best is someone who kind of has that strong why. And I've had a lot of working with a lot of seniors in my career. Those are the people I actually enjoy working with, and it's because they have they have great stories. They really they just naturally they'll just kind of drop these little hints, and they just have so much more perspective on life. Like every time you think you have something figured out, like life kind of shows you something. Like there's another, you're kind of here, there's another layer to what's going on in the world. And I like personally working with them, and their whys are very strong and they're very motivated, because again, they want to keep those qualities of life up, because they've busted their hump for till their, whenever their retirement days is. Like, I've got my finances and I've got everything set up for me to like be in my golden years. I want my body to be able, like, that's my admission ticket for all these golden years is my body. So they're very motivated. So those are the people that I like working with. Now, granted, I've worked with everybody from newborns to people in their 90s, and the approach is different, but I do personally, I enjoy working with some of the older demographic. I really do, our seniors.
Hey, so my daughter just got home.
Yeah, it's all good, man.
But yeah, motivated. I'm just thinking, like, as a coach or like an advisor or someone who's helping someone along on the journey, there's no one better than someone who's motivated and committed. And you touched on it. Pain brings them in, and that also makes them committed, because once they're sick and tired of it and they've had enough, they're open and receptive to a new direction.
Yeah, when the student's ready, the teacher will appear, kind of thing. It's like I coached college baseball for like 8 years, and so it was very interesting to see people that were very confident and were always like successful, and then they didn't have success, and then they were a little more receptive to your coaching. Like, okay, I don't have all the answers. I am open. I am hungry. I am motivated, and that's not just to our seniors, but working with like high level college athletes that are also just that very motivated, and we're going towards something, a purpose. Or we have a very strong why. It's like that really helps kind of just calibrate everything that we do, and with those underlying factors that are present.
Yeah. And teamwork, like connected to something bigger than yourself. You're going for something it's going to take more than just you. Like, you're not going to do it alone. It's team sport,
Yeah. It's the all these sayings are just flooding to me right now. It's like, if you want to go fast, go alone. If you want to go far, go together. That saying. So it's one of those where really I think naturally I kind of want, a lot of folks have that I want to do it myself thing, or that like kind of I don't need anyone, which that serves folks to an extent, but also comes to a time where it's just it's more advantageous to trust a professional or trust an expert and just, look at it as I do want to do it myself, but I do also want to get to my goal in an expedited fashion because time is the ultimate currency. And yeah, that's just one of those things where that urgency is there. So those are great people to work with, people that are urgent, people that are ready to take action. That's that makes me excited to come into the office, and it makes, what I do awesome.
Yeah. Awesome. Well, for someone who's ready to take action today, where can they find you? Like what website? Do you have social media, your office?
Yeah. We're Optimized Chiro on Instagram and optimizedchiro.com. You can find us there on our website. There's more information about myself, more information about my partner, Dr. Charlene, who focuses more on kind of pediatric and pregnancy. So really with our, I guess said more of my old expertise with our seniors, we really can serve a large range of our community. And that's something that we're really excited about here in Reno. So yeah, optimizedchiro.com. Come check us out. You'll find more about us and more about how we can help.
It's awesome. Yeah, that's part of our why too, is just here, like making these resources, these wellness resources available. Because you touched on it, like the proactive way of living. And, I think part of it is not just having access to it or knowing about it, like understanding what's actually going on. So you talked a lot about education, so it's educating, but it's also just making it available so they can have it. So that's part of our reason here, is just to open up our network of wellness professionals, and regardless of whatever background it is, but if it can help people live better, more energized, vital lives, that's what we're doing. So
absolutely. And it's not just like it's not just one, it's all of us that will collectively bring, our immediate, are we thinking of Reno, but that ripple effect we make of, effects here just with one person, they show up better in our community. And that's how we collectively bring, our immediate surroundings up, which is what we're super passionate about, is like plugging in and just like, let's just make a healthier community, because that will reverberate throughout the world. Because people aren't just going to stay here in Reno as great as it is. They're going to go out and do other great things other places.
Yeah, well, the principles apply no matter where you are, right?
Oh, yeah.
It's just where we are. So
yeah, absolutely.
Cool. Well, Dr. Ben, thank you so much for your time today. I really appreciate it. Do you have any other parting thoughts or like final wisdom that you wanted to impart on us today?
Yeah, no, Steve, thanks for having me, man. This was great to talk shop and just talk about our whys. And I love what you're doing. And that's what it is. How we found each other initially was just having these conversations with other healthcare providers and just wellness providers. And, I appreciate you having me on, and let's, highlight what really, we have a lot of great resources in these communities. If our community takes advantage of them, that's how we can really elicit some big changes, which is what we're here for.
Yeah. Yep. Absolutely. It's all banding together. We're one individual, but 3 individuals become a group, and then we can grow from there. But yeah, awesome. Well, thank you. I appreciate your expertise and your time today, and we'll talk to you soon.
All right. Thanks, man. You too. Take care.
Thanks.